Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. We are excited to welcome Dr. Robert Pearl, a professor, best-selling author, and former CEO, and industry thought leader, recognized as one of the most influential physicians in the nation. Welcome, Dr. Pearl.
Thank you, Laura. Good to be here.
Thank you so much for joining us live here in Las Vegas at the A4M World Congress. So, Dr. Pearl, you've accomplished an extraordinary amount throughout your career so far. Former CEO of the medical powerhouse, the Kaiser Permanente Group. You've consulted politicians. You've led and taught thousands of physicians, and you have truly made a lasting impact on the conversations we are having regarding the healthcare industry as a whole. But let's go back to the beginning for a moment. How did your passion for this work first begin? And how have you sustained that passion throughout the years?
It goes way back to when I was in college, and I never thought about entering into medicine. I was going to become a professor at the university, and the individual who I thought was the most remarkable teacher I had encountered didn't get tenure because of his political views. And when I tell people this, they usually laugh. I went into medicine because I was sure there'd be no politics. I mean, after all, it's life and death. Either you live or you die. And that's how I got into medicine in the first place. And I came to Stanford for my residency after being at Yale. And I discovered that there were a lot of politics. And that patients, as a consequence, were not always getting the best care that they needed. I finished my training in Stanford in plastic and reconstructive surgery, focusing on kids with cleft lip and cleft palate. I was about to go to South America to do some volunteer work for a year when the plastic surgeon at the local hospital in Kaiser Permanente died in a tragic plane crash. And they asked me whether I'd come for a few months. I said, what's a few months? And I slowly found that I liked working in this integrated organization. I didn't know anything about it when I first joined Kaiser Permanente. I enjoyed the collaboration that went in place. I liked the mission-driven spirit that was there. And in my first year, actually, the operating room was in big trouble at this hospital. The nurses were insufficient in numbers, and they asked me whether I would take over being the operating room director, not director of the operating room, but the head of the OR committee. Now, I assumed at the time it was because my credentials, Yale and Stanford, my brilliance. Now, everyone else turned down the job. I was the only guy foolish enough to take on what seemed to be an impossible problem. And I came up with solutions, and I enjoyed that process. And that's how I really got into the leadership role, taking on ever larger accountabilities until the opportunity came up to see whether I would take over the role, as you say, of being the CEO inside the Permanente Medical Group inside Kaiser Permanente. And I enjoyed that tremendously. And I did that for 18 years. Helped to move Kaiser Permanente to #1 in the nation based upon the National Committee for Quality Assurance on clinical outcomes. And then I decided it was time to move on to the United States as a whole, 330 million people, and take what I had learned across my career and now into a third career, be able to transmit it to others. So it's a long journey, and I think leaders find that, but I found it incredibly fulfilling at every point along the way.
Incredible. And this is hard work, Dr. Pearl. So sustaining this drive, what has contributed to you staying the course?
It's interesting. You know, there's an expression I love that when you do something you love, it's never work. I don't think it's hard. It is lots of hours. I tend to work 12, 13, 14 hours a day between my writing, my podcasts, consulting, being at meetings like this, keynoting addresses. But I enjoy it. And I enjoy it because of mission and purpose. And one of the things I fear about American healthcare today is that it's losing that sense of mission and purpose, the sense of putting the patient first, making care really about how do you make people's lives better, not just prolong them, but actually make them better. So I don't find that it's particularly difficult, although, as I say, it is long hours. I fly between the East and the West Coast almost every week. I continue to teach at the Stanford Medical School and Graduate School of Business, and I also work in Washington, D.C. and New York. So the combination together does take a lot of time and energy, but I go home feeling like I've really made a contribution. And if together we can improve American healthcare, if we can increase longevity, increase the health of people, increase their satisfaction and fulfillment, I will be one of the happiest people in the entire nation.
Earlier today, Dr. Pearl, you led a powerful presentation at the A4M World Congress titled Fixing American Healthcare, Structure, Reimbursement, and an Aging Population, all topics important to this organization. Can you share and elucidate on the role of the everyday medical practitioner and their role in contributing to solutions to these problems?
Well, let me begin by saying this has been a great conference, that the speakers have been very inspiring, specifically around this double notion of making life longer, but also making it more vital, more fulfilling. And I think it's a unique conference in that particular way, and it aligns with the things that I'm working on. You know, there are things that we know today that can both prolong life and give you better quality of life. Stopping smoking, getting the preventive services that you need, exercising every day, being able to maintain a more normal weight, avoiding diabetes as a consequence, feeling more alive and able to do these athletic endeavors. There's what's called a virtuous cycle of these pieces fitting together that go along with that. There's more to it than that. There's also, how do we make medical care convenient? I mean, if you're going to fly somewhere, you don't call a travel agent anymore and wait on hold. You go online and book your flight. You can't do that in medicine. If you need information, you have a kid going to kindergarten, you need a form printed, you have to go to the doctor's office or own a fax machine. Medicine is incredibly inefficient. And as I talk about in my book, Mistreated, Why We Think We're Getting Good Health Care While Usually Wrong, about my dad's death from a medical error, 200,000 people dying prematurely, with impact not just obviously on their life because they're dead, but their family's life, their parents' life, their children's life, their communities. The system itself is so broken, and this opportunity to bring the pieces together, to ask ourselves simultaneously, how do we live longer, and how do we live more fully, and how do we reduce the tragedy that often is associated with medical practice? There definitely is a role for the individual physician, because it's the individual physician who has that doctor-patient relationship. But it's more than that. I think there's a role for all of the individual physicians. Sounds like an oxymoron, but it's not. How do the doctors come together to work together as one on behalf of patients? The physician culture today is one of competition. Competition about outcomes, competition around who gets the patients, competition around the various financial aspects, and it should be one of collaboration. Physicians working together as one, using modern technology, being paid around their ability to prevent disease and avoid medical mistakes, and having a leadership structure that can organize this to which they're all willing to work in partnership.
You mentioned some of the organizations earlier, like the NCQA, and this idea of converting what the outcomes and what the drivers should be as opposed to what they've been. I think the needle has moved a little bit due to organizations like that. I happen to think they're a great one. Their HEDIS measures a few years ago I thought was pretty fantastic. Do you see those outcome orientations towards the patient, towards preventative and wellness care? Do you see that really happening? Is there more work in that specific aspect?
Well, it's essential. Another good organization is Leapfrog, that's looking at the hospital outcomes. How can you know how well you're doing without data? I teach the Stanford Graduate School of Business, and I can't think of a company in this world that doesn't have information way beyond anything that medicine has. I mean, the individual physician has information on the billings, may have a little bit of information on the clinical outcomes, very little. As soon as you go to a broader community, it gets less, and across the country, it's even less than that. How do you get better unless you know how well you're doing? So I think that it's essential. I would say we've made teeny tiny steps. We still pay over 90% of this country on a fee-for-service basis. I talk about American healthcare being a 19th century cottage industry. You know, that's called piecemeal paying, the way it used to get done. You get paid for doing something. The more you do, the more you get paid. If you have a mistake, you often get paid twice. There's nothing around outcome of value. The same is true for the drugs that we use. The same is true for the hospital services that are provided. No, that opportunity to be able to focus on outcomes, I think we're a long way away from it. And it's because of two factors. I don't think people have the willingness to make the changes that are necessary. They're afraid. People are always afraid of change, but in this case, there will be consequences. It's always easier to do more than do better. I think it's going to take a major revolution. I think it's going to take some very significant changes, actually at the congressional level, and you're facing lobbyists opposing it. Look today, what you see is that this notion of transparency billing. What's it going to cost me to deliver a baby? What's it going to cost me to have a joint replaced at a hospital? The hospital organizations, all 5 of them, are suing to prevent this information being made available to patients. Why is that? Because they know that once patients understand this information, they're going to make choices, and they don't like that. They prefer patients to be in the dark. If you're going to be bringing a drug forward, all you got to prove is that it's not risky. You don't have to actually prove that it's any better, and you certainly never have to compare it to what currently exists on a price-benefit ratio. And what you find is that often the newest treatments are no better in outcome, and yet they cost 5, 10, 20 times more. I think we're still a long way, Laura, unfortunately, from where we need to be in moving from volume to value.
You know, on our main stage, you mentioned your father. I get the sense he was an important figure in your life, and the sense that his passing transformed a bit of your work, or at least refined it to some degree. What was he like? What impact did he have on you as a physician, as a person?
So my father, Jack Pearl, was an amazing man. As I said on the stage, he worked his way through college and dental school. World War II comes along, and he could stay safely behind American lines. He volunteers for the 101st Airborne, parachutes on D-Day, captured by the Germans, leading a daring escape through the forests at night. You know, Tom Brokaw calls it the greatest generation. He was an inspiration in that way. Being able to really just accomplish so much in his own personal life, in the community that he was involved in professionally. So I think he was an inspiration for what's possible. And then my brother and my sister all benefited, obviously, as a consequence of that. His medical problems were impactful upon me moving this along. I'd say they were more, though, reinforcing. And for the listeners who haven't encountered someone in their family having major medical problems, it's hard to imagine, it's impossible to imagine what will happen to you when this negative event happens to a parent, to a child, to a spouse, because trying to navigate the American healthcare system, simply being able to get access, information. I said in my talk that the most commonly used technology by which physicians exchange information today is the fax machine. And when I tell that to my students in the business class, they all say, "What's a fax machine? Why don't we use modern devices, whether they're smartphones, whether they're computers, whether they are iPads, to be able to exchange this information?" Often, a physician will take a piece of paper, right? They'll have to then, take information out of the computer, print it, enter it into a fax machine. It's received by a fax machine. They print it out. They enter it into their computer. We could solve this problem. What is it going to require? It's going to require that Congress force the manufacturers of the current electronic health systems to open up their APIs, their application programming interfaces, allow third-party developers to come in to develop apps that become clinically useful. And now they're going to be able to make care that much more efficient. As I said, I think my father's experience overall, everything he went through before he ultimately died of the consequences of the medical era were very informative. But his end of the life that I also mentioned, to me, I think really focused how broken the system is, how much people are mistreated. At the end of his life, he has a stroke. My brother and I fly to Florida. My father's strapped down on the bed, intubated through his mouth, feeding tube through his nose, doctors lining the hallway, ENT wanting to do the tracheostomy, GI wanting to put in the feeding tube, neurosurgery wanting to take a piece of his skull. My dad's not going to get better. What he needs is palliative care, supportive care, compassionate care. We tell his doctors we don't want anything done. For 2.5 days, we don't see a physician again. The American healthcare system doesn't reward doctors who are with families in the times of greatest need. There's no ICD-10, no CPT code for compassion, for empathy. And I think the people who are hurting as a consequence are not just the patients. It's the physicians. What we see is that burnout, this notion of lack of fulfillment, lack of energy, inability to be effective. 44% of physicians, 400 suicides a year, more than one a day, in what should be the greatest profession that's out there, because I think physicians understand that what they're doing today is not what the purpose and mission handed down through 5,000 years should be. It should be having that compassionate relationship with the patient. It's now about the computer, the data, the billing, the claims, the insurance company. You go down the list of things. None of that is why someone chooses to go through the rigor of 10 years of training of medical school and residency.
I couldn't agree more. A4M has covered that topic quite in depth, especially last year with Dr. Pamela Weibel. I personally have written some editorials for journals in the alternative medical world about this topic. In terms of that physician culture and that strained position practitioners can find themselves in, I think about that, I would be probably frazzled or crying all day long. Is this somewhere at the level in maybe graduate school training that could be addressed? I've heard there's a disconnect between that because of the rigors of medical school and what they're teaching physicians to be, that they do need to have this steeliness maybe. Do you think that's a part of a solution?
So the book I'm currently writing, which contracted to finish by July 1st, so I have a lot of work to get done, is tentatively titled Burned. It is the clash between the physician culture, which is like every culture, very slow-moving, and how rapidly the science of medicine, the technology of medicine, and the societal values are shifting. And as this clash between a physician culture that's outdated and these rapid advances, the computer being an example, data analytics, data information, the technologies that's possible through video, through data analytics, artificial intelligence, and the societal values, men and women, end of life. You go to an ICU today, you got to ask yourself, is this treatment or torture? You have people who are never going to speak, never going to eat, never going to manage their bowels, never get out of bed, who are going to be kept alive for a long time period, poked and prodded, and the physician culture is just not able to do it. However, we're talking about culture, and culture is not something that anyone controls. It's interesting to me, I was watching a movie, the Tarantino movie, and there's this rooms full of people smoking and not even noticing the smoke. And I said, if this happened today, everyone would be outraged. You know, no one said to be outraged now and said to tolerate it before. It's just the world in which you grow up, the values that you inherit. And that, I think, is going to be the biggest problem, because there is no way to evolve that culture quickly, because it's not like you can write a policy manual, write a book. It has to occur. And it's part of why I'm now in my third career. You know, in my first career, I had the chance to influence the lives of, 10 or 20,000 patients. I knew everyone in great detail. One of my favorite things is, on the first month that I was there, I fixed a cleft lip. I then fixed that child's cleft lip. And then I got called by now the grandmother about the third generation with cleft lip. But I'm now no longer clinically practicing as I do this third career. Then I became CEO, the largest medical group, impacting the lives of 12 million people. I didn't know any of them in that great depth, but I knew a lot about all of them. And now I'm looking at this nation as a whole. And the question I pose to myself is really going to be, how do we move that culture? How do we get physicians to be different? It's why I speak to events like this, to reach out to individuals. It's why I encourage physicians to come together and have the conversations. In many societies, there's what's called a third place. So you have your work, you have your home, and there was this third place that people would go, going way back to the Greeks. It was the agora. Became many of the taverns and pubs across the Middle Ages, different places where ideas would be exchanged. And right now, one of my big fears is that physicians live in isolation, often in their own offices. They have a lot of people, but they don't interact with their colleagues to talk about these things. And I believe that that's what's going to have to happen. I do think social media can advance it, because that can bring a lot of voices together. But even in social media, we tend to listen to the people who think like us and tell the people who think like us. And now we need a much more diverse conversation. Again, it's what I really enjoyed about the A4M conference, because you have clinicians here, and you have researchers here, and you have policy people and public health people, and just interested individuals in technology. You have the entire breadth of individuals coming together to have interaction, conversation, debate, and hopefully to slowly move the culture about what is the meaning of life, how do you extend life, how do you value life, how do you be more vibrant in life, how do you have a bigger impact in life. Those, I believe, are the right questions, and we often get lost in who's going to pay and how much is going to be paid, and a lot of other important questions, but not ones that are going to solve the problem of American medicine.
We could talk about that for more and more hours, I'm sure. Winding down here in our interview. Last question, Dr. Pearl. We're approaching a new decade very quickly. What's your hopes, your visions? What are you looking to learn next?
It is interesting that we're already in the third decade of the 21st century, or about to start the third decade of the 21st century. That's a long time. 5 years from now will be a quarter of a century. And my greatest unhappiness, let me start with the negative first, is how little change and progress we've made in American medicine. Every year, a variety of publications ask me to have a look back. And increasingly I'm saying nothing is different. People are not living longer. In fact, they may be living shorter. We're not applying the things that we know to being able to improve the health that we deliver. For all the talk of technology, it's not that different than it was 10 years ago. Again, not to understand it's not small progress, but the amount is so slow. So from that standpoint, I would say one of my biggest concerns is how little is different. The optimism that I have is that we know what to do. If we integrate care both horizontally and vertically, physicians in the same specialty working as one and vertically between specialties, if we're able to move from a fee-for-service to capitation, if we're able to introduce the technologies that are designed to solve patients' and doctors' problems, not for billing, create a leadership structure that sits in place. If we do many of the things that we know are going to allow physicians to work in ways that are going to be more fulfilling for them and more satisfactory for their patients, we have those opportunities. It's going to require courage and will at the congressional level, at the regulatory level, at the individual physician level, at the hospital level. And right now, my biggest concern is that things are in a sense too good for people, at least for the major players, the hospitals, the insurance companies, and the drug companies. I'm not sure for the individual physicians, but it is for some of the specialties that are sitting there. Myself, personally, as I approach it, I'm enjoying tremendously the opportunity to speak literally 60 different conferences this year, hundreds of thousands of people. My Forbes blog has been read by over 5 million people. I have a monthly musings that I publish that people can get to through my website, robertpearlmd.com. A tremendous amount of readers through LinkedIn, through Twitter. So I have an optimism that is there. I think, if anything, my goal over the next decade is to move this process along quicker. And I think to convince doctors and patients that for all of their fear of change, for all of their fear of practicing healthcare differently, of utilizing technology, of working together, of finding ways to invest in prevention, avoid medical error, invest in patient safety, all the things that we know, that their life and world will be better. And right now I think that people are afraid, and the consequence of that is they continue to be mistreated, both as patients and as physicians. That will be my focus for the decade to come. This is my third career.
Well, thank you so much, Dr. Pearl. The A4M is so grateful for your time here at the World Congress in Las Vegas, and we wish you all the best, and we'll certainly be following you.
Thank you, Laura. It's been a pleasure, and congratulations on having an amazing conference. I know the attendees have had a great time and learned a tremendous amount. Thank you.